O'clock, and it's Wednesday, January 28th, 2026. We call this meeting to order to get an update from the Ambulance Service District, and we'll start off with Bruce.
We had a very busy month of November and December. As Chief Miller knows, I go into panic when we go 2 and 3 ambulances all the time. We are having to fix at least 1 or 2 ambulances a week or more. They're just flat wearing out. We have 3 reliable, 2 IFers. Chief Miller will give you an update on where the new ones are at here in a little while, but first thing I want to do is commend the shooting on December 26th, being a member of the fire department in Mullen and on the ambulance district. Our fire and EMS people in Shoshone County did one hell of a job. We had every fire department, ambulance, everything in this county, plus some coming from Coeur d'Alene. We were all on our own channels on the radios or cell phones, and John was kind of instrumental in all that. He got everything pretty much centralized so the sheriff's office could handle their situation, and I thought, put it mildly, we had our stuff together. And for people that we don't always get together and train with the paid fire districts, Pritchard Murray was involved, Mullen was involved, so I want to commend all the people on our side. Plus I listened to the whole sheriff's office deal on the radio, in station. Our dispatcher did one hell of a job. And I don't know where we're at on that, but I have not heard any comments about any of this, and I would like to bring it out in the open. I listened to it the whole time at the station. I could hear the gunfire and the bullets hitting the glass, and she did not break a sentence, raise her voice. She directed the officers. I thought she should get some sort of recognition, and I think the EMS and the fire services appreciate her too. So, moving on, with budget cuts, Chief Miller has been kind enough to track some call numbers for us. We went over it in our meeting last month. Before October, we were staffing out what we call the third out ambulance. So basically, we had 3 911 ambulances, or we had 2 911 ambulances and a transfer ambulance, whichever the call came up. We had to cut it out because of budget concerns, which luckily, very luckily, we had a mild winter so far, as we haven't been really strained, but we were in the month of December, John.
Mm-hmm.
So I'll let John kind of go over that part of it with you. He's got all the stats, and you can have her, John.
Well, I'll just pick up on the call part. I did print off some info.
Yeah.
Since we're talking about the calls, at the top it just refers to the month of December, where they had 150 calls. 94 of those were transport calls, so 63% of those 150 were transports to a hospital. Again, 40 refusals, etc. We did have 26 of the 94 transports, so 28% of all our transports went to Kootenai Health. And the reason that's a statistic worth talking about is just that's an extended time for a 911 ambulance to be out of our area. Again, I know you all know But the more we kind of get the word out, the more maybe everybody will know. There's only 2 staff 911 ambulances in this whole county, period. Pritchard Murray's folks, they'll come from home. So that's what I mean by staffed, is in there's a dedicated crew ready to go, not because we have 5 or 6 ambulances can they hit the road all at the same exact time at any given moment. Only 2 of those can hit the road at any given moment. That's why that stat's interesting and also somewhat of a concern, but I wouldn't say outside the usual. I think SMC had one of their imaging down for a couple of days, and that caused a lot of transports to Cooney. So that could have been part of the reason why those are up. But the biggest thing that started to be tracked in late November through today, and which is the second half of the first page, is the third out staffing. That is staffed by either Carrie Simmons, who is our admin assistant, myself, or our fire marshal. So you can call them us admin folks, but we're not working admin 100% due to the kind of the rate and the call volume of these. So 26 times in a period of 29 days was it needed to be staffed by either volunteers, admin, and the admin's usually business hours is when we can do it, and that's if we're not at meetings or doing something else. Off-duty folks, again, these folks work 56-hour work weeks already, or volunteers. So it's December showed to be almost every day. 7 of those 26 times that third out ambulance have to hit the road as in dispatch to a 911 call. And so that included, so with those 7 calls for that third out, then we had to put a 4th out ambulance. So you're asking for more people to come in. And again, to run an ambulance, it has to be at least a minimum of a driver and an EMT. Or else, if they're not licensed through the state or in our system, they can't provide care legally. So it's not just anybody can go respond to these. It has to be at least one licensed provider. So 7 times we had to call another crew in on top of that to be 4th out, and that actually hit the road twice. So 9 out of 26 times that these 3rd, 4th out calls have to hit the road and respond. That has been proven to be, again, extremely challenging and taxing on the crews. Again, they work 56-hour work weeks. Every now and then it's okay, but on an everyday basis, it's starting to get unsustainable to a degree. And we showed that the month of January, or tracking from December 27th to just January 27th, 37 times was it called and needed to be staffed. Again, this is admin, off-duty, career folks, or volunteers. 5 times out of 37 that it occurred twice in one day. 3 times that it happened 3 times in one day. And twice it happened 4 times in one day. And these aren't set times, obviously. This is a 24-hour work operation, so it could be 9 in the morning, could be 2 o'clock in the morning. That's what makes it also more challenging to try to find a schedule or try to make it fit for these folks. And so of those 6 out of 37 times was it actually dispatched to a 911 call, and 1 time of the remaining 31 times the 4th out ambulance actually get dispatched. So that's what we're finding to be an extreme challenge in the history of the ambulance district and the fire districts trying to handle this. I've got 6 people on, full-timers on a day. 4 of those are assigned to an ambulance. 2 of those are only assigned to a fire engine. However, depending on the tone that you get is what apparatus you jump in, so they're not only on an ambulance or only on a fire engine. However, we have a duty to our taxpayers as a fire district that our fire district pays for staffing firefighters 24/7 regardless what it is. And so that has proven to be taxing not only on the EMS side of things to make sure we're there to answer these calls, but also on the fire side, that we give our taxpayers what they're paying for as it pertains to just fire. So it's been a challenge in the works. Chief Dietrich and I are trying to find ways to alleviate this without the burden being financially on the fire districts. And we've seen to have that a bit of a challenge. We're working through something. We're currently, before we were consolidated into one group, District 1 had hired 3 part-time employees where they just get a stipend per day, but they're in the fire station either for 24 hours or 48 hours, and they're basically a paid staff minus the benefits, minus the full-time pay, but they're doing the full-time work. That has proven to be to work for us at that time, because again, at the District 1 at one point, we only employed 2 full-time firefighters a day. Well, it takes 2 people to run an ambulance. So the ambulance would go on 90% of what we do is EMS, go on an EMS call, now our firehouse is empty. Or it's just myself there. So my obligation was like, well, do I go help the crews out on this call, or do I stay back and stay on the fire engine in case something else happens, ready to respond in a fire engine, not a chief vehicle? So that's proven to work. We were able to do that. District 2 at the time wasn't, just due to funding, how they were using those funds. We're since trying to see if we can bring on more of those at a maybe reduced rate, to try to get that, but we're just got to obviously look into the books, and it's like, well, is this going to cost the fire district, not the EMS district? And how do we basically make this work with what we have already? Which obviously went into part of the consolidation efforts, is to consolidate everything and share these resources and get rid of all the redundancy payments that we're paying for, softwares and et cetera, to be able to do this without having to go to the taxpayers. That was the big reason why. So we've got some ideas in the works, but obviously still have some research to do to push that through. If we were to get more residents, I think some of this weight could be lifted to a degree. But the frequency of this is just, it's not going away. So once I started realizing it's not going away, I started having to track it. And when I start tracking it, it's pretty alarming, December, but then January, as you keep tracking it, is just getting kind of worse. And SMC's imager wasn't down in January, so I can't use that as an excuse for longer transports, et cetera, et cetera. And just on the back of this is just the overall numbers for 2025. EMS-wise, the crews responded to 2,075 calls. That's about 6 a day. That's only EMS calls. Had a 67% transfer rate, which is pretty good, pretty average. Again, some of the calls that we get for refusals are people driving by a car accident where no one actually called 911, but people driving by and they're not hurt, but we respond anyway. Sometimes it's just, I slipped and fell, can't get up. Those are the bulks of the refusals. Some people just don't want to go to the hospital. And we can't take them to the hospital unless they agree, or else it's technically kidnapping. So those are some of the things to keep in mind as far as the refusals. We did have our 3rd and 4th out ambulances were dispatched to 191 911 calls. I put in there the I-90 calls, just out of, I know Commissioner Zimmerman was kind of interested in that, and folks are kind of interested in that as well. I had 144 to Interstate 90 this past year, 418 transports to Kootenai Health, 365 days a year. It's a little over 1 a day. That again, a 911 ambulance is out of the area for at least 2 to 3 hours. And then we had 404 actual fire calls that were not EMS related. And that's just kind of the year in review statistics on that part. Otherwise, I'll keep going with Bruce's points about the maintenance. When it rains, it pours. We've been pretty lucky for most of November and December as far as needing kind of maintenance on our apparatuses, which is very nice. However, we started incurring some issues and it just kind of fell from there. So we have a 2016 Ford that had an inverter switch malfunction to where when it was plugged into Shoreline, a switch wasn't switched to the inverter to get all the parts and the batteries all charging on that. It's got 163,000 miles. It is currently in service. However, it's checked and needs to be ran every day until that part is here to keep everything charged up and going. Another 2006 Ford has a complete inverter failure. This is the second of these 2016s that has had an inverter failure. That part has been ordered and that vehicle is currently out of service. We also have another 2016 Dodge. It's got about 151,000 miles on it. That the heat in the patient compartment is only working intermittently. It has been diagnosed and a part has been ordered for it. Unfortunately, it has to stay in service as well. The crews have found ways to manipulate the front cab where their driver is to transport heat to the back. However, cold as it gets, half our job is customer service, and it's very hard to make people comfortable or satisfy people if they're freezing in the back. Our Horton, which is a 2022 model that already has It's been on the road for just under 3 years, has 103,000 miles on it. The Stryker load system, which loads the gurney into the patient compartment, is completely down. So that our second newest ambulance is out of service as we await for that part to be delivered, and it has been delayed due to the ice storms in the southeast. But we're hoping to get it back in service today, tomorrow, sometime this week. But obviously we can't load a gurney into that ambulance. Otherwise, mechanically it's fine. But if we can't load a stretcher into it, then we can't really use it. The other one is a 2013 Dodge. It's got 145,000 miles. It's in service. So currently we've got 2 completely out of service. 2 that are in service need extra care and observation. 2 be in service, and really 1 extremely still healthy ambulance. I did get some updates on the 4 on order. We're expected to have arrival of a brand new Horton ambulance, April. The 2 bronze that we have ordered should be arriving in May. And then our second Horton should arrive sometime this summer. So we do have an update on those and expected timeframes to be here. And I imagine next month maybe Chief Dietrich and I will get with Timmy and Carrie, Miss Eddie, to go over kind of how that all looks. Because I know there's 190 something from a grant, and we got to make sure our paperwork's in line to appease the grant process by itself. Personnel-wise, we do have an EMT class that's about halfway through. Last I knew, there was 30 students in the class. It probably has dropped a little bit as the class gets more into it and gets a little harder. But locally, there's a lot of local folks in there, a couple Pritchard folks in there, a couple of our volunteers, and just a couple of other local folks. So that's going well. Again, we do CPR classes all the time. However, in December, again, we dealt with flooding, winds, and active shooters. The windstorm found challenging because, again, our department usually runs about 8 to 10 calls a day, and we had 23 calls in 2.5 hours between, I think, about 6 in the morning to 8 in the morning the day of the windstorm. Chief Dietrich and I did call in the night before to let the off-duty folks know that their assistance would probably be needed and to go ahead and build a roster. Thankfully, that was done because we used everybody and every rig we could for that. So grateful for these folks again. And then the active shooter, what we had is we have done some trainings from outside agencies a couple of years ago through an ARPA grant, which gave us the equipment to handle mass casualties. So we'd had the medical equipment in one place to provide up to 30 patients of any kind of mass event, ballistic vest, helmets. At that time, that was a District 1 grant, so we only had 6 total of that gear to use. Now we're obviously a lot larger department, so we're going to have to find a way to upgrade that so our folks can stay safe. But altogether, we had 4 ambulances and 2 fire engines and 2 chiefs within the first 10 minutes. Since we have a plan in place for this, and again, we train with outside agencies, but it's twice a year we'll train with our local law enforcement. The goal is to get into every school once a year. However, we're going to start maneuvering out of schools and into streets and other places just to get a better layout of the building itself, but then different plans for different places. But for that day, again, we had 4 ambulances, 2 fire engines, 2 chiefs from here. We called an ambulance from Pritchard Murray, and we called for a strike team, which is basically 5 units from the Coeur d'Alene, Kootenai County area. And they provided 3 ambulances, 1 chief, and 1 engine. And we also landed a helicopter at SMC and in Silverton as precautionary. We don't know quite what's going on. This wasn't a 911 tone out for reasons why dispatchers could not tone that out. As when it happened, they had to move quickly, so they couldn't press buttons or get on the radio for us. So everything was done cell phone wise. But I think we had around at least 20 people in the first 10 minutes. And by 30 minutes in, we had close to about 40 people that were usually staged close. I think it was to the 1910 coffee shop area. And a few of us, high-end folks, kind of closer, but not directly here, but just a block over to try to get some communication of who's in charge and what do you need from us kind of ordeal. Since obviously it's chaotic, we just kind of staged what we knew had. We did have an ambulance real close I think at the Wallace Firehouse to be able to be there as soon as possible. And we had 2 of our members are part of the rapid action team that were actually firsthand involved. And part of it was we have what they call Knox box keys, which are kind of the black boxes usually in front of bigger buildings. The fire department has a key too, and usually there's keys to the building in there, and we had keys to the jail and a Knox box in the back, which we were able to access for the sheriff's office to get in and out of there. So overall, a really good response, ready for anything, but didn't quite know exactly what we had. Thankfully, we didn't have to use our own people. We did have one EMS call in the middle of it, and it was from, I believe, a family member of some of the victims that were shot earlier. I think was having a moment. So the Pritchard Murray ambulance actually transported them to the hospital, but nothing to the actual event itself was needed from us. But again, a very good turnout altogether as it pertains to that. Other than that, again, just extremely grateful for all the members that we have. Last month and a half has been pretty challenging, so their commitment to their community department is not to be overlooked. They've worked their tails off and continue to, but it's been a pretty challenging month and a half. But all positive things to report, maybe minus the ambulance maintenance stuff, but these crews are getting through it. And Evan, our fleet maintenance guy, has been working in pretty good. But without him, I think a lot of these would be delayed pretty rough, or they'd have to go over to Kootenai County for repair every single time. Yeah, and left. So luckily they're getting taken care of in-house locally and faster than previously. Other than that, didn't know if you guys had any particular questions about anything in particular or anything I can try to
No,
get
thank
for you for the
you
next
for the detailed information. I appreciate it.
I had a couple of just because I'm curious to know. So how do you decide if you're transporting directly to Kootenai or to SMC?
There's 2, to my knowledge, there's 2 methods for it. One, the patient can request to go to Kootenai Health. Usually that requires us to contact SMC to talk to their doctor directly and explain what we have, because legally we cannot bypass the closest facility for care. However, that's the patient's request, and usually that's not an issue. SMC's been pretty good about that. If they want to go to Kootenai and they're not critical, that's usually done. Other than that, it's since we have paramedics, if they are deemed to need immediate care, that such as a cath lab, which is usually for heart attacks, to imaging, stuff that the SMC cannot do, we will take them straight to Kootenai to get them the care that they need immediately versus going to SMC and then just getting transported an hour later to Kootenai County. I do know that in the past 24 hours, our crews have responded to 3 cardiac arrests. I think there's been maybe 4 in the past 5 days, and 3 of those 4, our crews have been able to get what they call return of spontaneous combustion, which is basically the breathing and get their heart rate back. Again, I give that credit to the crews, but having a paramedic license to be able to give those medicines and interventions that the hospital can to get that patient in a better position. So hopefully we'll be handing out some CPR safe pins to quite a few people coming up. And we did call Lifeline, I think, twice in the last 20 hours or so as well.
I think people watch this will be surprised at how busy you guys stay. When you look at the 25 statistics, how do they compare to 24? Are we really seeing more calls for that?
That is a good question. Unfortunately, I don't have that data on me. That's something I can get. The only thing that might find it challenging is we have switched our software for EMS reporting, and I gotta see if that was for in the middle of 23 or in the middle of 25. We're gonna have to go to 2 different softwares to try to pull it, but I don't know specifically EMS wise. I know fire district wise, since you include these numbers, even when we ran a bond for the new stations, there was an uptick every year. Then you had COVID, which definitely brought it up for a year or 2. I'm not sure if it plateaued, went down, or stayed on that trend. But historically, leading up to 23, I would say it had been on the uptick for 10 years straight. Part of it, it's not necessarily the population. As far as a more higher number of populations, it could be the population of people are getting maybe more aged in our area. The tourism definitely has an impact. We've had 2 ski resorts. We have the Coeur d'Alene River area. We have the Hiawatha, and we have all abundance of outdoor ATV, UTV trails, and that's all our area. And those are probably most likely, not taxpayers that are using taxpayer resources to respond to these calls. And I know I've talked to Commissioner about that and how that's been a strain on our system. And we're trying to find ways to, how do you get funding or awareness for that? I've looked into hotel tax, emergency tax, when I first got in this position, but that was shot down immediately because we are a district and not a city. So we cannot do that. So that was one avenue I've looked into. I know the Idaho Fire Chiefs Association and their lobbyists are trying to push to make it to where districts can use that. But at this time, it's kind of down to Boise's idea and see what they can push that way. There is some good stuff on the horizon potentially coming out of Boise. There's what they call impact fees, which again can only be used in areas that have that growth, and the fire departments can only use it for growth related things, such as a brand new fire station and a brand new engine to go in that new fire station. Those fees and those funds cannot be used for anything that you currently have at all. I can't replace a fire engine with it. I can't do maintenance on a current fire engine with it. It is only growth related, and that's some of the things that the Idaho Fire Chiefs are trying to find a ways to at least, can you give us, if we use these funds, can we use it for maintenance? That would work well in the Coeur d'Alene and Kootenai County area. It's not going to work out great here because it costs a lot of money to implement impact fees. At this time, you only have a certain number of years. I believe it's 6 years to use those fees, and then it goes away. However, if they were able to use that and change it to where you could use it for maintenance on current apparatus, that would be a huge plus for us. One of the things I failed to mention, I know it's come up in the past few, and I know Melissa knows a little bit about it from the meetings, is there's a program called GMT, which had been passed a couple of years ago at the federal level to where it'll increase the percentage of billing from Medicare. Currently, Medicare, I think, reimburses about 20-ish% of our actual bill. So if I had a $1,000 bill, they're only going to pay 200 of it, and there's nothing we can do about it. They have increased that percentage, and so now that it's been funded and it's in movement, it took a couple of years for it to get implemented. We are working on the 2024 statistics to provide those numbers to give some funding to us for that. But at this time, that's about the only kind of funding source we were able to find other than one EMS grant for either ambulances or major equipment. There's only a handful of small grants for EMS wise and fire district wise. There's a bunch of small grants. There's only one major one. It's the Assistance to Firefighters grant through FEMA, or the Recruiting and Retention grant, but those have been on frozen since last year. We applied for a station generator in Osborne and an air fill station for our bottles or in the packs that the firefighters use, and we have applied for that in January of last year and have not heard anything since. So those are only two big grants we were able to capture on the fire district side. Everything else is going to be small here, there, and everywhere.
Thank you for that.
Yeah. Thank you.
Timmy, did you have anything you wanted to add today?
No, mostly it was just going to talk about the third out ambulance stuff and whatever. As far as financially, we did manage to cut back and squeeze through last year with about $300,000 left in the bank to get going in this year, so that was good. And yeah, we're just plugging along. We've got about just under $500,000 in the bank right now after getting taxes in, so things are going pretty smooth. Tight as always, but we're getting through it.
Wow. Bruce, did you have anything else you wanted to add?
Yeah, I got some bad news. We got 4 coming. We got to be thinking down the road this coming month with our next meeting. I'm going to bring up to the board that we got to be looking at maybe ordering at least 1 ambulance. We're sitting 2 years out for these things, so.
It takes 2 years to get one from when you order.
The Hortons that we ordered in last of September of 23, so they're 2 years and 5 months or so out, and we're not getting them till April. The Bronze, on the other hand, have been fantastic. We've worked with Bronze since the corporation had it.
Mm-hmm.
They pre-order their chassis, so they order like 100 chassis, so they're a little quicker in turnaround, but we're still looking at a minimum of 18 months.
Hmm.
So I hate to say it, but we're gonna have to, we don't wanna get into a situation where we're falling behind on them again. We won't have to hopefully get 2 or 3, we'll just get 1 every 2 years or something to that effect. It seems to be, well, our oaths, our one is 3 years old, our Horton.
Mm-hmm.
It's got 103,000 on it. So that tells you right there, and it's 103,000, it's right at 3 years old now. We put it in service in January. So I hate to say it, but we're gonna have to think about getting one pre-ordered and at least have it on the books, and hopefully Timmy's helping us a whole bunch with the budget, so hopefully we can pay for it out of the budget and not have to go outsource it for buying them. So
Well, if you weren't doing 2,000 calls a year, you probably wouldn't be wearing out these ambulances.
well, if we didn't have so many miles between this county, you gotta consider we're going, how far below Meadowmont do we go?
I think to the Y, I believe.
So we're going State Highway 3 to State Highway 97.
Yeah.
And up north, when you get out in the woods up the Coeur d'Alene River, who knows, we're just about probably the Montana-Canadian border, basically.
Mhm.
And then you turn around, we'll go look out top of 4th of July. And if Montana can't make it to on the lookout, we go down that side of ways. We go clear over on the St. Joe on Hiawatha.
Hmm.
So
The board did discuss somewhat retrofitting maybe one of the
Yeah,
older
one of the-
ambulances into more of an
good point.
more rugged off-road one to handle some of these dirt roads that these ambulances will go on from time to time, to try to alleviate maybe the wear and tear as it pertains to the off-roading that they are required or have to do. So they're, at this point, just an idea to throw out there to the board to consider, but I think that would probably be a very wise idea, as these again have to go up all sorts of roads. I mean, you all know what some of these roads look like. That's more or less the dirt roads. So that was also discussed at the last meeting.
I think that's one of the things that the SRS money, Title III money would actually help with.
Mhm.
Because it has to do with force and
Well, that'd be nice. But we got, with the 4 coming, we'll have 3 that we're gonna get rid of.
Mm-hmm.
So we could keep, 1 is gonna go to SMC for them to use. That will still be available to us for 911 if needed, but they have nothing to transport basically from the hospital to the airport. So we made a deal with them that we would give them one of our better ambulances, so if we were down, we could still back up on that, but we could get one of the others and set it up as a quick response type ambulance. Moon Pass just kills them. Burke going up Cooper Pass. You're up Steamboat. You know what that does. So if we could get those vehicles, they're not going to be a cushy ride, but they'll be set up to where at least we won't be beating the chrome off them, so to speak.
Makes sense.
So we are entertaining. We haven't really looked at the disposal of what ambulances yet, but when we get the new ones, we'll worry about that.
Well, let me say thank you for just how much service you're doing in this county. I think it's very revealing for the public when you talk about how many times a day and how many times a year you're having to respond to our citizens. So definitely appreciate what you guys are trying to accomplish here, and it looks like you are accomplishing it.
Yes.
And it wasn't meant to be a doom and gloom stat. It was just more of this is something we can't track it through dispatch because it's not the call signs of the ambulances or what they would go by, not third or fourth out. And just when it seemed to be so much, that's when I just started tracking it. And we've always done a good job of handling these challenges internally without not making any external noise. But we found that obviously you can't raise awareness if you're just handling, they're not problems if you're handling it all the time. So it's more of just an awareness than it was meant to be a doom and gloom kind of moment. It just takes a lot. And again, you call for help every now and then, it's not that big a deal. But if it's every single day, throughout the day, that's when it just becomes a very challenging.
It's a big challenge with disasters going on. You have, you've got firemen out doing the power lines and everything, and then same time you've got no power. The ambulances are going to pick up these people that are on oxygen or medications of some sort, get them to the hospitals where there's power. And they did a good job. I mean,
Yes.
Yeah.
Thank you.
We had, in Mullen alone, we had 8 generators out of our station that we had people, we knew of people with oxygen, that we had little generators that they ran their packs off of. So we did get ARPA money for our generators, so both stations are generator up. We did have older people coming in. They used the microwave, the kitchen in the fire station uptown. The biggest thing is charging their cell phones. And then with City Hall being open like that, they used TV to find out through the local news what was going on. So I think the people that had generators had TV and everything, but we didn't have the internet to get.
Right.
So we set a generator up on the morning club and had that backed up. So for the last 4 days, we had generators up till 8 o'clock at night. So at least people could get the news or find out what was going on. So it's just something nobody ever thinks about.
I don't remember windstorms like this as a kid here. I don't remember that happening, and not with this frequency. So,
Well, now we need to get the USFS and
Yeah.
start logging. Let's get this timber that's down on the roads that's easy to get and clean the roads up in the middle of the forest for us.
well, is there anything else from you guys or Commissioner?
No, thank you. Thank you
Yeah,
for
thank you,
all that
guys.
you're doing. Thank you to all your staff. Thank you for the detail. And no, it's great. It's great because you're reaching out to the public too, and anybody that's watching it can get a better understanding of what's going on and what you face on a funding aspect as well. So I think it's great.
Our
Thank
meetings are the third Thursday at 5 o'clock in the Osborne Fire Station.
And thanks for commending the guys and gals for their work and for the dispatcher comment too, because
Well, without
Yes.
them, we can't do our job without them.
Yes.
So
people forget all the good things going on.
Yes.
So thanks.
No problem.
Didn't take it as doom and gloom either.
Yeah.
Just took it as, wow, that's a
It's
lot
just
of-
something I don't
Yeah.
think has ever been brought up again because we just handled it internally. But
Yeah,
like
you
I
just
said,
don't think of a small county having that much emergency,
Yeah.
health issues. So
I think
All
we
right.
all have that expectation when you call 911. You expect somebody to be there quick,
yeah,
and solve problems, and luckily we've been there. But at some point, it just worries me that there's going to be a time where you get 3 within 5 minutes, and people are scrambling, or people are going to get delayed.
yeah. Well, thank you very much for all of it, and with
Yeah.
that, we'll adjourn.